Welcome back to the Popped Podcast, where we uncover real, raw, and rarely discussed truths about pregnancy, birth, postpartum, and beyond. I'm your host, Dr. Emily Muery, prenatal and postpartum chiropractor, birth doula, and founder of Move Moms at Move Chiropractic Boulder. Today, we're diving into my favorite pregnancy hormone. But before we do, if you haven't noticed, the podcast space is looking better and better each week. Last week, I took the week off to really inspire myself in the space again. That first podcast back in this space, while I was editing it, I just felt a lack of inspiration and excitement. And normally I feel so excited to do this podcast, to edit it, put it out with no expectation of anything in return. So I wanted to make sure that I was still doing this through the lens of excitement and passion and just true curiosity in the pregnancy, postpartum, and motherhood world. So I feel more inspired. I have some of my favorite moments with mamas over time behind me, and I feel better in the space. So whether you listen or watch, hopefully that translates into this episode, and I hope that you enjoy our discussion today. So we're diving into Relaxin. It's my favorite pregnancy hormone because I feel like it's what I work with most as a chiropractor. I think a lot of people have a misconception of what Relaxin is or what it does in the body throughout pregnancy. A lot of times people think that Relaxin is just the hormone that loosens everything up and makes everything really relaxed, which is true, but there's so much more to it. What is Relaxin? What is that actual hormone inside of our body? It's a peptide hormone that's produced by our ovaries, our placenta, and then later it's produced in the uterine lining. It's present in most non-pregnant people, just at very, very minimal levels. And during pregnancy, the levels increase dramatically depending on the major structural changes that happen at certain times throughout pregnancy. So if Relaxin isn't just loosening the body, what else is it doing? Relaxin helps the body to adapt to the growing baby and prepare your body for birth by softening and lengthening ligaments so that the pelvis can widen, adapt, and eventually allow baby through. Relaxing smooth muscle, especially in blood vessels. This allows increased blood flow throughout pregnancy. This, I don't think we think about a lot. We think about all the swelling, we think about everything feeling loose, but all those smooth muscles within our blood vessels that line our entire body that involuntarily pump our blood all day, every day, those start to loosen and relax so that more blood can fill those vessels so that your body can produce more blood. If I haven't said this in another episode, your blood volume increases a lot throughout pregnancy. Where does all that blood volume go? It goes in the same place it's always been. It's in those blood vessels. So whether it's the chicken or the egg comes first, your body needs multiple things to happen. And some of these things that happen actually work perfectly in divine function together to support the body and what it needs throughout pregnancy. And this is one of those, increasing blood flow while also loosening the blood vessels around so that that blood flow can increase. The body with Relaxin in it is also going to help prevent premature contractions by relaxing the uterus early on in pregnancy and early on in labor. That Relaxin allows your body doesn't love to feel everything pushing out or overstretching. And when it does that, it's going to try to contract and save whatever it is. Typically, I talk about this with muscles. If you stretch out a muscle too much, if you notice your body wants to pull it back because it's trying to save that joint. It's the same with the other soft tissues in pregnancy. If your body's being stretched out, it's going to try to contract to try to save whatever that tissue is that feels like it's being stretched too much. If we think about women who have periods, all women, most women, when we have periods, your body is expanding with that blood flow and then trying to shed the lining. That shedding of the lining is a little bit of stretch on that uterine lining, and that's why your body starts to have those cramps, those contractions. It's not just the actual act of shedding the lining. Your body's actually has protective mechanisms when things get stretched out too much. So relaxin allows that uterus to soften so that as baby continues to stretch out the uterus, it doesn't prematurely contract around baby and start the labor process. Relaxin is also going to affect the kidneys by increasing filtration. You're essentially running two bloodstreams, and we're going to come back to this later because I think this is really important. I think a lot of times we think that when babies grow or when we're pregnant, babies growing on top of the bladder is what always increases that need to pee. But relaxin actually plays a huge role in that need to pee. And then lastly, we have remolding of, and probably not lastly, but last on my list right here, we have relaxin is helping remold connective tissue throughout the whole body, not just the pelvis. There's a lot of things that are changing throughout pregnancy. I'm sure that you've noticed or that you will notice or that you've noticed in your previous pregnancies where your feet change, your ribs change, your shoulders change, your knees change. There's more than just your pelvis and your belly changing. We start to feel and see physical changes in other joints and areas of our body because soft tissue, connective tissue, it's all connected in our body. It's all changing throughout pregnancy. So we see those changes elsewhere, not just in our pelvis. This is why pregnant moms suddenly feel looser, wobbly, things don't always stay where they used to, or they feel strong but unstable. You're not imagining it. That is normal. That is what relaxin is doing. You're adapting to the hormone that literally reshapes the architecture of your entire system for pregnancy, labor, and birth. So, why does relaxin matter so much for our birth prep? Think of relaxin as the hormone that makes birth physically possible. It helps soften your cervix. It's going to allow your pubic symphysis to widen, this really tough cartilage that we talk about or that we've talked about before in the past that holds your two pubic bones together. It's the toughest cartilage in your entire body. Its nickname is Tough Mother. It has to stretch for a baby to come out. Relaxin also reduces the tension in your pelvic ligaments so that baby can descend, rotate, and move through the birth canal. It also prepares your pelvic floor to stretch without tearing. And why nobody talks about relaxin, I'm not really sure. It typically is just overshadowed by other huge hormones like oxytocin, progesterone, estrogen. It's not that important. It is. It's just running a completely different streamline of events and processes in your body throughout pregnancy, labor, and birth that we don't always think of it as the culprit of certain issues or things that we are experiencing throughout pregnancy. So without relaxin, birth would not be physically possible. Imagine your body pre-pregnancy, then trying to push out a baby without any preparation for 10 months. That's a lot on the body. There's a lot that the body preps for 10 long months so that the body can push a baby out. And relaxin has a huge role in what happens during those 10 months so that we have that successful labor and delivery. So the big reframe for relaxin, as we keep diving deeper into this episode, is that relaxin isn't the problem. It isn't the enemy of stability. It's not what ruins your posture. It's purposeful biology designed to create space, pliability, and adaptability. It isn't your job to fight relaxin. It's your job to understand it and then work with it. What is relaxin doing when and where in our body? If we understand the timeline of relaxin, we can better support our bodies through those peaks and through those dips of relaxin as we go through pregnancy. Relaxin isn't a steady hormone. It doesn't stay in your body for the same amount. Actually, most hormones in your body aren't steady hormones and they shift all the time. Even if they're in cycles, it doesn't necessarily mean that they're steady. It means that they're a shifting hormone. It can shift at any point depending on what your body needs or what part of a cycle, any cycle it's in. So it moves through the body, it moves through pregnancy in waves, and each wave has a purpose. When you understand the timeline, all the weird body things that you feel start to make a lot more sense. So pre-pregnancy, baseline levels of relaxin. Even in non-pregnant bodies, relaxin is present in very small quantities. It rises briefly after ovulation to support implantation, which is why some people feel a little extra loose around conception or around their cycle, just in general. But most women don't feel it here at all. First trimester starts, and suddenly we have a spike in between weeks 6 and 12. I would say often it starts to pop off on week 13, from what I feel as a chiropractor. Relaxin skyrockets early, way before a bump, nausea, even before most people share that they're pregnant with their family or friends. Why? Because the body is already starting to remold to support a viable pregnancy. Relaxin at this stage will soften the uterine lining for implantation. It relaxes smooth muscle to prevent early contractions, and it begins softening the pelvic ligament right away, which is why a lot of moms who come in early for their pregnancies are so confused why they feel so much pain around their belly. They are sometimes nervous that something's wrong with baby or that the pregnancy isn't viable because there's so much pain or cramping, and they're equating it to period cramps or feelings that they would have with premenstrual cycle symptoms. So sometimes it's confusing. It really usually is just those round ligaments or uterine ligaments starting to relax and start to loosen to create more space, so that because your body knows it's not going to shed that uterine lining that month, it now needs to make space to create more space for all the space that baby's going to start to take up. I know that was super repetitive, but hopefully you followed me. And then also at this stage, relaxin starts to adjust the rib cage and the lower back to make room for later. Also why a lot of people have early discomfort in early pregnancy. It also prepares your blood vessels to handle the increase in blood volume. That's why some moms notice the wobblier feeling even before they look pregnant. That's okay. It's super normal. It's what your body's supposed to be doing. Relaxin typically has its peak levels at that 11, 12, 13 week, which starts to coincide with some moms' nausea or morning sickness. So it tends to feel very overwhelming in the body at the same time. You're not broken. I see you. I hear you. Typically, it takes time. I hate that that's the answer for a lot of things in pregnancy, but some things just take time to pass in your body as your body starts to learn, adapt, and tolerate the new things that are happening inside of it. In the second trimester, what happens with our relaxin? This is our plateau. It doesn't mean that it totally empties out of the body, but we start to have a plateau or more of that steady state for relaxin. This is happening in between weeks 13 and 28. Funny enough, in between this time, week 15 to 25, is our most amount of growth in the shortest amount of time. Keep that in mind as we go through this plateau. Steady hormone in the body. We don't have any extra relaxin. It's staying really steady. In this phase, moms start to feel pretty good physically. The ligaments have started to soften enough, but not too much. The pelvic discomfort tends to be a little bit lower. The body starts to balance the new center of gravity, and chiropractors can feel early asymmetries as the pelvis adapts. This is where we start to get into our catch-22 of the relaxin plateau, but the most amount of growth in the shortest amount of time. Most amount of growth in the shortest amount of time. That means your baby is going to grow the most and the quickest that they will in the shortest amount of time in their whole lives. That's a lot of growth in your body for typically a lot of first-time moms, first time that's ever happened in their body. So it's going to be a massive change inside of their body. When this happens, your muscles, your soft tissues, everything is going to stretch. Like I said earlier, any soft tissue that stretches typically wants to contract to try to save whatever structure or joint that it's supposed to be protecting. So in this most amount of growth time, starting at week 15, we have this big stretch in the body without any extra relaxin coming through. It can feel like you're doing tons of glute workouts or leg workouts or back workouts and you haven't lifted a finger. That's normal. That is totally normal. It's not wrong. It's not right in the body, but that's the typical progression of how your body is going to shift structure-wise with that relaxin plateau. Your body will start to tolerate that stretch and overcome that, and your body starts to learn, okay, we have this extra laxity from the last 10 weeks, and now we have no extra laxity, but a stretch of baby. And your body is going to start to learn how to work with both of these and put them together so that we have this mutual growth. That's why about week 22, week 23 is when we see that belly pop. Not always. Sometimes moms pop around 17 weeks. Sometimes moms don't pop around 26 weeks. No pop time is a bad time. But usually around that 22 to 23 week pop, that's when the body starts to really understand, okay, we've got this extra laxity in these soft tissues, baby's growing fast, everything starts to match up a little bit better. And then usually by that week 25, 26, the growth has come back more to a steady level. Relaxin peaks up a little bit more so that we can accommodate for now how big baby is, and everybody starts to get just a little bit of rejuvenation and a little bit of rest in their body from this massive stretch and growth that happens for 10 to 12 weeks. I put the note at the bottom of this. It's the sweet spot of pregnancy for many, and it is. Typically, somewhere in there, we find that sweet spot where we start to feel comfortable in our bodies. It doesn't feel like everything's stretching or breaking or so wobbly. Everything starts to feel a little bit more stable. And then we have the third trimester, the second wave, weeks 28 to birth. As a chiropractor, I notice 2 mini waves within this last wave, typically around that 29, 30 week slot. I see a little pump of relaxin. I just feel it when I tend to adjust moms. There tends to be a little bit more laxity in their joints. And then again, really close to birth, I didn't know for a while that I felt more relaxing close to birth until I had enough moms who came through my doors and that I was adjusting close to birth, when I would be like, oh my goodness, your neck is so lax today. And then 4 days later, they'd have their baby. That happened enough times where I started to gain my own understanding and feeling in the office. A lot of times I don't tell moms, hey, I think you're going to have your baby in 4 days, but I will let them know, hey, it feels like there's an extra relaxin pump. We might be getting closer to labor and birth. Just something to keep your eyes on or your awareness around. So this phase is all about preparing for the main event. The pelvis becomes more mobile. The pubic symphysis begins to widen. Your sacrum gains more play, which is why the Webster technique is so helpful and why it's so important that you're doing it so consistently throughout all of your pregnancy. It's like if you had a dentist appointment tomorrow and you're like, man, I didn't brush my teeth for 4 months. I'm going to brush really hard tomorrow for an hour before my dentist appointment. Is that going to work? No, that's crazy. It's the same with pregnancy. You can't do 10 months of work in 4 appointments. So get your booties to the chiropractor as soon as possible. It is really important that you're consistent with your care for the sacrum mobility in pregnancy, labor, birth. Okay, anyways, back to this. I know that was a side tangent. We want that more we want more play in that sacrum so that it can make space for baby to actually descend for labor. The cervix begins softening, joints feel looser and less stable, sometimes even slippery. Sometimes I hear moms feel like their hip is going to give out when they go downstairs when they're when they're in these relaxin pump times. So something to think about. Round ligament tension can spike because everything is shifting, and those round ligaments, as much as we think about them being the bowl holders, they really are trying to support your body up and against gravity. So they are fighting against all physics and all gravity to try to keep some support up, but that support is only going to be so strong when we have a full-size baby and a body contracting to push baby down for labor and birth, so they might start to feel tired, tension, softened. Moms often say it feels like everything is moving all at once. It might feel like baby's going to fall out. It might feel like a million other things. Whatever it does feel like, it does not mean that something's wrong with you. A lot of times it means that your body is using this last relaxin pump to make space for the last moments and movements that baby needs in order to help themselves get out. At birth, relaxin is at its purposeful peak, obviously we need to be our most open, our widest, our most available for baby to come through. So at birth, relaxin is helping the pelvis open, allowing the sacrum to nutate and counter nutate freely. That's just that rock. I've talked about it in a lot of my birthing classes. The pelvis wants to go in and out, or the sacrum wants to go in and out like this. A lot of times I'll just use this. I talk about this a lot in my birthing classes, but your sacrum wants to counter nutate and nutate this way while you're in labor. But a lot of times you get to a hospital and you're put into a hospital bed, and this is what happens when you lay down in a hospital bed. There's no space for that sacrum to come back into extension, right? So we want to make sure that we're giving moms the option throughout labor to have that motion through their sacrum, because that's actually what's going to allow baby to work their way down through the birth canal. And then we're also going to make space for rotation, descent, and delivery, protecting the perineum by increasing stretch capacity, right? The perineum, we talk about the perineum typically tearing. That's where most moms, they don't want to tear. They want birth to be simple and no tearing. I hear that go a lot in our office. Your body has built-in mechanisms so that there isn't tearing, but the more that you're consistent with the supportive care, it allows those mechanisms to express themselves throughout labor and birth, the more that will actually happen for you. So get to the chiropractor. After birth, the drop. There's a big drop in relaxin, but it doesn't go to zero. So I want us to keep that in mind. A lot of times we feel really tight in our bodies postpartum, obviously. And of course, it makes sense. You just pushed a whole baby out. There's a massive stretch in your body. Your body is going to start to try to recover. It's just like going to your first stretch class and someone trying to put you into the splits. If you've never done the splits, you're going to be really sore the next day, right? Same here. The relaxin, though, because it doesn't go to zero, it's going to help your body find that elasticity back in our muscles, our ligaments, our soft tissues, and start bringing those tissues closer back to where they were pre-pregnancy. Obviously, not exactly pre-pregnancy. It takes a long time to get there, but we'll get there. Relaxin is going to help you get there. If you choose to not breastfeed immediately postpartum, you have about 3 to 5 months until that relaxin is totally out of your system. If you're a breastfeeding mama, that relaxin is actually going to stay in your system until you're done breastfeeding. And then once you're done weaning off from breastfeeding, it's about 3 to 5 months after that the relaxin's out of your body. So if you're breastfeeding, relaxin's going to remain elevated in your body. Your ligaments will stay softer for longer. Your joints will stay more mobile, and your pelvis will feel less stable. This is why I tell moms who are breastfeeding, this is the perfect time to take care of your body, to recover your body, especially if you're a first-time mom, or especially if you are looking and wanting to have more kids in the future. One of the biggest indicators for successful pregnancy, labor, birth, postpartum of second, third, fourth, fifth children is how the first one goes. So how we take care of our body during pregnancy, during labor, during birth, during postpartum with our first baby really does tell our body what's right, what's normal, and how it should be for future pregnancies. So, postpartum, if you're first-time mama, if you're second-time mama, third-time mama, whatever, postpartum, with that relaxin in your body, that is the best time to recover your body, your spine, your spinal health. Your spinal health is what's going to allow your brain to work as a mother. So, the better you take care of your spine, the better you will be able to show up as a mother in this new journey, in this new phase of life, because you're regulated on the inside. So I tell this to a lot of moms during pregnancy. I also tell it to a lot of moms postpartum. During pregnancy, your body is in its most adaptable state. With all of this relaxin, with all of the estrogen, with all of the changing hormones, your body is in the most adaptable state it's ever been in. It's going to grow a human in 10 months and then push it out. That's incredibly adaptable. However, you're growing a baby that's getting bigger inside of you. Symptoms in your body tend to get worse throughout pregnancy. Postpartum, you are in your most adaptable state, except you're not growing a baby. So you have all the same things, not all the same, but a lot of similar levels of hormones in your body, and changes in your body in those immediate postpartum, let's talk about the first 3 months postpartum, in that immediate postpartum time without growing a baby. So things can get better really quickly if you take the time to take care of your body. However, we have a baby now. So a lot of times moms forget about themselves, and it's baby time. You have a newborn, and those first 3 months with a newborn are intense. It's a lot. It's a big shift. It's a big change. Even if you've had previous children, it can be a huge shift in your family or in your home. And so it might be hard to take care of yourself, to recover yourself the way that you want to get yourself to the appointments that you want to get yourself to. It is incredibly important that you do your best to get yourself to the chiropractor and to a pelvic floor PT, especially if there was some trauma to your pelvic floor during labor and birth. 100% of pregnant moms' spines go through the ringer because they're pregnant, and your body is shifting and supporting a whole nother human. Your posture is going to change. Your spinal curves are going to change. No matter how hard you try to keep them perfect and amazing, they're going to change. So take care of your body. Postpartum, this is the time to take care of your spine. The quicker you can take care of your spine, the less problems you're going to have later. I have tons of people who come into our office who have 10-year-olds, 20-year-olds. They're like, I've had this pain since I've had my kid 20 years ago. Oh my gosh, can you imagine if they had recovered their spines properly in those first 3 months postpartum, and how much more amazing those last 20 years would have been without any chronic pain? Take care of your bodies. You deserve to be taken care of. And if it really makes this big of a difference, because sometimes it does for people, to prep this or plan or prepare for this recovery time, prep for it. Tell your chiropractor, I want to have a plan for my postpartum recovery care. I need to have a plan. If we have a plan to get my spine back to where it's at, or to where we want it to be, or to these certain goals, having a plan set in place for postpartum, something that's already waiting for you, something that you only have to show up to. That's the only piece of accountability, is you showing up. It can be so much easier to be accountable for those recovery changes in your body. Prep and plan if you can. If that's not your vibe, that's okay. That's not your vibe. If you go as you go, that's how you go. But the more that you can prep and plan for that postpartum recovery, the better it's going to be, and typically the better you will recover. Again, I hope that all made sense. I know that was kind of a tangent. If you didn't get anything from that last little section, when does Relaxin go back to normal? It's about 3 to 5 months after pregnancy, or if you're breastfeeding, 3 to 5 months after you're done breastfeeding. I feel like I've been talking for so long. I have to check in on my pregnant family real quick, everybody. So hold on real quick. Okay. Everything seems to be good with my doula mama. So we're going to keep going. Minor intermission there. I'm currently on, I had all my new cameras. I don't even know where to look. I'm currently on call for a client for doula support right now, and we're in the early stages of labor, so I'm just going to try to finish this podcast before baby comes. If you are the mama who is on call right now, you know who you are, and you're listening to this, you're doing awesome. The whole podcast is rooting for you. Woo, woo, woo. Everybody root her on. She's going to do awesome. We'll come back with some updates postpartum. I'll let you know how she did. She's already doing amazing, though. So what does Relaxin feel like? And that is why, hold on, let me come back one more time. If this podcast episode also comes out late this week, I'm so sorry. My pregnant mama, who's in labor, is in labor. And so this podcast episode might be coming out on Tuesday, Wednesday, Thursday, or whenever I get it done, because I also work a full-time job as a chiropractor and now a doula right now. So what does Relaxin feel like in the pregnant body? I am sure you don't need me to tell you this. If you are pregnant and you're watching this, I'm sure you have felt the woes of Relaxin by now. So Relaxin isn't something that you see. It is something that you feel. It changes the body from the inside out. And most moms can't quite put into words the sensations, but they feel typically wobblier or looser, or like my pelvis is going to fall apart, or I feel like Gumby. These are just some things that I hear in the office a lot. Everything feels stretchy or unsupported or unstable. This is classic relaxin. This is relaxin doing its work. The ligaments that are normally holding your joints secure, they start to become softer, longer, more pliable, and less able to resist movement. So we think about ligaments. I don't know that most people don't know the function of every single thing in our body, but for example, muscles' function is to support, have the ability to contract or lengthen at any given time. Ligaments, their function is to support by not allowing motion. They stabilize. They check motion is usually what we call it what we called it in chiropractic school, is you're checking ligaments. You're checking to make sure that they check or they stop certain things. So if you think about like a door stopper will help keep a door handle from smashing into the wall. Similar in our body, ligaments are like door stoppers so that things don't crunch or fall past ranges of motion that we should have or that are safe for our body. So I like thinking of it like that. Ligaments are kind of like the door stoppers for our joints. Joints start moving in these new, bigger ranges. So relaxin increases our joint play, especially in our pelvis or sacroiliac joints or your SI joints, your pubic symphysis, your lumbar spine, your low back, your ribs, and then your feet and your ankles. This is why pregnant women often feel clicking, shifting, popping, cracking, extra flexibility, joints that feel like they're falling out of the body or giving out. Again, this is classic relaxin. This is normal. This is purposeful. This is not pathological or anything that is wrong with you. And then we have the strong but unstable feeling. This is not every mom, but I actually run into this a lot with our moms in our office because we're in Boulder, Colorado. We have a lot of moms who do CrossFit either through their pregnancy, prior to pregnancy, lots of variations of some form of CrossFit in their routine or at one point in their routine. A lot of these moms tend to feel strong but unstable, and so a lot of times I hear I can squat heavy, but it feels like my hips are going to give out when I go up the stairs. Or I can squat heavy, but I feel clicking in my hips or my pelvis when I try to stand up. That is relaxin. That is that feeling. That mismatch happens because muscles can stay strong, but the underlying connector of the structures starts to change. So that door stopper starts to get a little bit looser, and it allows those muscles to go a little bit further, allows those joints to go a little bit further past their typical range of motion. And so things start to feel a little bit more uncomfortable, a little bit more unstable. Your ligaments aren't damaged. They are responding to hormonal signals. Your muscles are just trying to compensate and support for those changes in that lack of support. Then we have pelvic pressure or asymmetry. Relaxin makes the pelvis more movable. It also means that one side can shift more than the other. The sacrum can tilt differently. It doesn't always just go front and back. It can go side. It can go in a diagonal. It can go in the opposite diagonal. There's infinite places for the sacrum to move. The pubic symphysis can widen unevenly. It can widen more on one side than the other or have more stretch on one side of the tissue versus the other. This isn't just one singular band. There's tons and tons of cartilaginous fibers within one piece of cartilage. So one side could be stretchier than the other side. We also have baby's position can amplify any imbalance that's already happening inside of the body. And so many pregnant women will describe this as one-sided low back pain, deep butt pain, groin pulling, or it's where you do that round ligament movement, but it's deeper, where you're touching the inside of your leg only. SI joint instability, or that sudden zinger with very specific movements, typically getting in and out of the car or in and out of bed. This is your ligaments saying, we have more play now. We have more space to move. Please support us. So again, and I'm going to come back to this, don't be afraid of support. If your body needs more support, your body needs more support. Everybody's different. There are so many different things in life where we need more support or we need more time or we need more understanding so that we can do XYZ. Use support where you need it. Some people need belly bands really early on. Some never need them. Everybody's different. I've only ever had one mom not have any diastasis recti. There was no separation of her abdominal muscles. And it actually, she ran into a little bit of an issue with that towards the end of her pregnancy. There wasn't enough room for baby anymore. So everybody's different. If you need support, your ligaments need more support early on. They need more support early on. Talk to your chiropractor. If your chiropractor doesn't know, go ahead and send me a DM. I'd love to give you some support or some guidance wherever you're at. Your body, yes, sometimes I always recommend to my patients, don't lean into our support measures too much. We don't want any support measure to become a crutch. But if a support measure is helping you get through the toughest time or the toughest experience of your life, then we need the crutch. We have tools and we have utensils for a reason. And I don't think there's any problem with using our support measures when we feel like we need support. So what if we started to work with Relaxin instead of fighting it? Relaxin is not the enemy, but instability without any support, that is. We really need to make sure that your body has support even throughout all the instabilities that come with pregnancy. When a mom understands how to move, lift, sit, stand, and support their body during a Relaxin heavy season, everything starts to get a lot easier. So here's how to frame it a little bit more clearly and a little bit more compassionately. Stability over strength. Most moms think, I need to get stronger. But when we're in a Relaxin surge inside of our bodies, the priority actually needs to be stability, alignment, proper load distribution, and balanced movement pattern, all of which most people do not focus on and tend to think that we're going to get all of that within one chiropractic adjustment. The truth is, there's so much more beyond just the chiropractic adjustment. And this is why I provide such a comprehensive care plan for each of the moms in our office. The adjustment in the office is just the start. It's a jump start to a regulated nervous system. Well, your regulated nervous system is going to regulate that relaxin, but there's more to do with that relaxin. How are you going to take care of that relaxin in your body? I can only stand and support and hold and make your body feel as good as I can during our adjustment time, but that space in between, what are we doing to support the body so that it can continue to adapt and tolerate what's changing in the body until that next adjustment? Those 4 things are 4 things that I'm having moms practice and prepare for outside of the office on top of what we're doing inside of the office. Stability comes from so many different places, and our daily activities as a society in 2025 do not typically support a really functional pregnancy, labor, and birth. Your focus, especially if you're not coming to move to see Dr. Emily and you're not having this comprehensive care plan, I want you to focus on stability, alignment, proper load distribution, and balanced movement patterns. And if you don't know how to do those, find somebody who does. Reach out to me. I would love to help you get connected with a chiropractor or with a pelvic floor PT or somebody that I feel like could be a really supportive birth practitioner around you, where you can get these things focused on and worked on throughout your pregnancy so that you're not met with these being issues in labor and birth. If we don't work with Relaxin throughout pregnancy, you will meet stability, alignment, proper load distribution, and imbalanced movement patterns throughout your pregnancy, labor, and birth, and it tends to lead for more complications and issues later on. If we know what we need when Relaxin is surging in the body, remember I said our first surge is in that first trimester in between 6 and 13 weeks. And then that second surge after our second trimester throughout the third trimester, this is when we really need to be focused on stability, alignment, proper load distribution, and balanced movement patterns. We also need to be just as focused in trimester 2 when we have that plateau of Relaxin and the body is making this huge shift without any extra stretch or grievance in those muscles or ligaments. Yeah, we still have that Relaxin steady hormone in there, but it's not in any extra level like it was previously or like it's about to be in that third trimester. So functional movement and random exercise. I see this all the time. Random exercises, not worth it. When we have functional movement, when we have a plan, when we have an action list of items that we need to take care of, that is exercising and using your body. When we do random movements, that's not typically categorized as exercise. You have to have a plan. And so if you don't have a plan, come to Move, because I'll give you a plan. We have a plan from week 5 in 0 days to week 41 in 6 days. Every single day. I think it's 256 days worth of movement every single day. It's not a 45-minute workout. It's 10 to 15 minutes of movement, but it's planned and prepared movement for labor, birth, and all of pregnancy. If you don't have that, find somebody who does. Find a functional movement program where you are prepping your body, not just for all the shifts that you're going to experience in labor and birth and stretching to push a baby out. All of those are extremely important, but all the functional and massive changes that are going to change throughout pregnancy in your body, how you pull your clothes out of the dryer, how you put food back into the back of the refrigerator, how you make your bed, all of these functional movements of using your body is going to shift how you use your body, how you support your body with those muscles, ligaments, and the relaxin is going to shift how those muscles and ligaments actually support your body through those movements. Functional movement. We want to prep our bodies with functional movement during those high peak relaxin times so that we are building stability over strength. There's so many more than just these things in my program for our Move moms, but very basically, we go through controlled squats, lunges, slow hip hinges, cat-cow, pelvic tilt, walking, a lot of different prenatal yoga poses, gentle glute activation, side-lying leg work, core connection, not crunches. We're doing a lot of core connection with breathing. Our number one thing is breathing, decompression breathing. I think it hits so many facets of what you need in pregnancy, labor, and birth via calming your system, being able to calm your system, be able to decompress your spine, being able to get enough air and oxygen into your body to bring nutrients to your baby and to yourself so that you can get through whatever's to come in pregnancy, labor, birth, wherever you're at. So these movements are not it. There's a lot more movements we could be doing, but if we learn how to do these movements with functional purpose, we can have a lot more support in our body throughout pregnancy, labor, and birth. And if you're looking for a program, you don't know where to start looking, I would start, obviously, come see me. If you can't see me, start by looking at foundation training with Dr. Eric Goodman. They do have pregnancy-specific movements, and they teach you how to do it with a pregnancy-specific body. So that's a great place to start if you don't know where else to start. There's a ton of other functional training programs, but that one I really feel like gives you the basics without all the frills and glitter, even though we all know I obviously love all the frills and glitter. So alignment is everything. We just talked about this. The more consistently your body is in alignment and in balance, the better space there is for baby to grow. Relaxin allows space. Well, if that space isn't fully to its functional capacity because you're not aligned, that relaxin only does so much good for your body. We need to work with relaxin. Working with relaxin is getting adjusted, making sure that relaxin is evenly distributed throughout your entire body is the number one goal during my adjustment with you. I want to make sure that your body, as loose as it may feel in this area and as tight as it may feel in this area, we are trying to get you as balanced as possible with relaxin throughout all the soft tissues in your body. That alignment is going to allow for functional space for pregnancy. So it will allow relaxin to do its job appropriately, which then allows baby ideal space for growth. Babies will only grow in the space that they're given. So if they're given a discombobulated, smashed space, guess what? Babies end up typically having a very smashed position in the womb, and we see that postpartum. If you want to see some pictures, DM me. I can send you some cool pictures about what we call or what we talk about in chiropractic, and that is occupying the space. We want babies to occupy the space. If we don't give them enough space, they're not going to occupy all of the space. We need to give them the space. Otherwise, it's a waste of relaxin in our body. Get aligned, get to the chiropractor, or it's waste of relaxin inside of your body. Then we have the instability zone of pregnancy. This is when we have those boosts of relaxin and very specific movements in the body for very specific parts of the body that start to ignite this pain sensation or this discomfort or this extreme instability sensation inside of our bodies. A lot of these come with the pubic symphysis and the hip joints where your leg actually attaches to the hip itself, and then your SI joints. So 1, 2, 3, 4, 5, 6. This is typically where I see the most instability or that feeling of instability. The movements that we see this happening with are getting out of the car with feet wide apart, so stepping 1 foot out at a time, carrying a toddler on one hip, standing on one leg to put your pants on, which I know a lot of us do. So that shouldn't be too hard for you to imagine, but that one gets a lot of people. Twisting while holding weight, even just baby. Going upstairs unevenly. Pushing a cart with one arm. If you're holding a baby and pushing a cart with another arm, that's actually going to put a lot of stress through your arm, your side ribs, how you engage your core, and then how you actually support your hips. That one is a long chain of reaction of compensation patterns down into the pelvis. And then sleeping twisted or collapsing inwards. So that's typically laying on your side with an arm out where your chest starts to fall in and you start to collapse this chest. There's already not a ton of space for your lungs when there's a baby inside of your belly. So when we have that collapsing space, it can really, one, increase anxiety feelings or anxious feelings. It can reduce the amount of oxygen to baby and to yourself, so it can actually keep you up more at night. It can also lead to less restful sleep, which leads to a less rejuvenated spine, which leads to more compression, stress, weight on your pelvis, and typically more pain. The cascade of issues. So all of these things aren't bad. They're just typically signs and ways that I see moms experience and go through pelvic instability at some point in their pregnancy. Not all moms go through this, but the moms who do go through this go through it pretty tough, and we try to work with it every week. Everybody's different. Some weeks, all of a sudden, it's amazing and it's all good and it's cleared up. And some women, it lasts throughout their pregnancy. This is also a huge indicator of how you take care of your body pre-pregnancy. Some of my most successful pregnancy, labors, and births at our office, and what I would deem successful, just following the mom's wishes and vision and dream of their birth plan. Those moms I have typically seen far before their pregnancy. They're typically a quote-unquote normal patient in our office prior to becoming a move mom. And those moms then see me all the way throughout their pregnancy and tend to not experience some of these massive pain points or big shifts in the body that we hear more frequently from pregnant moms. So something to keep in mind. It's just your chiropractor speaking here with a little bit of a bias, staying on top of those instability zones by keeping your body as stable as possible, not just through strength, but through proper alignment and functional movement patterns. I want to jump back real quick to relaxin in the body for breastfeeding mamas and why it stays elevated. I think it's pretty interesting, but post-birth relaxin drops from its labor peak, but it doesn't return to that pre-pregnancy level of low. If you're breastfeeding, your body keeps producing relaxin at a higher than normal level and for as long as milk production continues. Why? Because relaxin is tied to ovarian suppression, prolactin activity, tissue remolding or remodeling, pelvic floor recovery, and ligament recalibration. How cool. I know breastfeeding isn't for every family or for every mom, and so this is not to be a ding on you if you're not breastfeeding. It's just good information to have that if you are breastfeeding, there's going to be more relaxin in your body. And these are some of the benefits that you're going to experience with that relaxin still circulating in your body as your body's recovering. And what this translates into for that postpartum body is elevated relaxin, meaning elevated ligament softness. Ligaments that have held snug joints pre-pregnancy are now able to have more play. They resist stability less, like that doorstopper. It's not as doorstoppery as it used to be. Requires more muscular support. You shift more easily, wobble under load, wobble while you're holding stuff. Struggle with core or one-sided twisting motions, and takes longer to tighten back up. These are not necessarily bad things. For some people, these are really awesome things. I have one pregnant mama who's now postpartum, who was a softball player, and so there was actually a lot of torsion and rotation into her right SI joint. There was a lot of tightness in her glute muscles and the backside of her right hip. Postpartum, there was so much laxity in her pelvis, part of her body that quote unquote never adjusted, or we didn't ever have a cavitation pop, crack, or feel a significant shift during adjustments pre-pregnancy. I mean, you would, it was moving like butter postpartum. It really can be that simple with the postpartum body without growing a baby or, all these stretches and shifts in the body moving outwards, where we have that adaptability still in the body with relaxin. We see massive shifts for people who have had chronic pain in very specific areas of their body completely eliminated in that postpartum recovery time. Hopefully you take a lot from this episode, but I hope that you take relaxin can be used and you can work with it, especially postpartum, to take care of your body and recover your body. It's just up to you to do it in a timely manner. Even if you are breastfeeding, that doesn't mean you have the excuse to not see the chiropractor until you're done breastfeeding. You still need to see the chiropractor. That's, again, the best time to see the chiropractor is when you are breastfeeding, when you are postpartum and your body is still in this most adaptable state, trying to remold and remodel the structures of your body. I've talked about a couple of these practical tips throughout the episode, but I want to kind of list them out here if you've missed them along the way. Prioritize alignment in the shifts of relaxin and in between the shifts of relaxin. The more aligned you are, the more easily your brain is able to talk to those hormones and to your body, to your muscles, to your joints, so that if there's too much relaxin in a joint and you're feeling an excess of motion in your hips or your knees or your low back, those joints with proper alignment can send signals up to your brain, hey, there's too much laxity here. We need to find support. You will then get the cue, hey, I need to find support for my low back, and maybe you'll get a belly band. The more aligned your body is, the easier it is for your brain to process and figure out what is happening in your body to tell you what to do next. When we are misaligned, imbalance in the body, dysfunctional, have subluxations, have not been adjusted, it is hard for your brain to get all of the communication from your spinal cord in that stressed out spinal cord, stressed out alignment. And so it's hard to process that information and know what to do moving forward. This doesn't mean you're stupid. It doesn't mean you're dumb. It doesn't mean you're not smart. It just means your brain is not getting enough information to understand what's happening in your body to make a plan of action of what to do next. You have all the tools you need. It's all inside of next. Daily movement rituals, small things, big impact. You do not need to be doing big, massive workouts, which you totally can, but you don't need to be doing them to have this big change or significant stability in your body to get through these relaxin pumps. Movement keeps blood flowing. It's a stabilizer and muscles will start to activate. I typically recommend daily walking, light prenatal yoga. We have tons of amazing prenatal yoga teachers here in Colorado. And so we have tons of referrals and recommendations all over the board. If you happen to be here in Colorado, I'd love to give you some recommendations. If you're elsewhere, I would love to help you find some if you can't find any. Again, cat-cows, pelvic tilts, deep belly breathing, and 360 breathing. We call this decompression breathing in our office, and it's trained through, I'm also foundation training certified with Dr. Eric Goodman. So If you go and look up foundation training with Dr. Eric Goodman, you'll find this decompression breathing. I don't know that they have a pregnancy-specific decompression breathing like I do in my program, but the same principles apply, so I encourage you to try that. Gentle glute activation, again, we don't need to be doing huge glute workouts, but having access to our glutes and actually having access to relaxing our glutes is hugely important. Side-lying leg lifts, and then hip hinging with a neutral spine. This is huge. It's great for your hips to open up. It's really great to stabilize your spine and find your spinal stabilizers, because a hip hinge requires your spine to be stabilized. Movement does not have to be exhausting. It just needs to be consistent. That's why my program has movement, 5 to 6 movements every single day. Not because I expect every single mom who goes through my program to be doing movement every single day, but because you're only one day from getting back on track. If a day comes up where you are so nauseous that you cannot get out of bed, guess what? The next day, if you feel a little bit better, you're only one day away from getting back on track of consistent movement. So we always have that access to movement, so that's always there, and it's easy, it's convenient, it's not the hardest movement you've ever done, but it's movement that's truly efficient in prepping your body for labor and birth. Strengthen the stabilizers, not the big movers. I know lots of moms that strengthen the big movers too, and they are incredible, strong, awesome moms who have incredible births. So this is not to poo-poo you if you're doing big movers or if you're a high-impact exerciser. This is just for those moms who are looking for a little bit more guidance, who aren't doing much movement-wise in general, but are feeling the woes of Relaxin. Relaxin puts extra responsibility onto our stabilizing muscles. So our deep core, our pelvic floor, our glute medius, our transverse abdominals, our lower traps, and our deep neck flexors. These work quietly but powerfully. Our simple stabilizer exercises to help stabilize those muscles that are going to feel these excess loosenesses. I'm just making up words now. We're getting close to the end, so that makes sense. Simple stabilizer exercises. Wall sits, clamshells. I'm iffy on the clamshells because I feel like everybody loves the clamshells. Clamshells are great, but they are not the only thing that you need to be doing. So, for every clamshell that you do, I encourage you to find a different exercise, an internal rotator exercise. Look that up. If you don't know what that is, it's okay. There's a million of them, but look up internal rotation exercise pregnancy. Meet your clamshells with those. We've got bird dogs, modified planks, breathing coordinated with your pelvic floor, zipping up the core engagement. That comes into my decompression breathing. And then standing balance work with support. A lot of times we'll do single leg balance work or rotation work on one leg standing up. It's a really great stabilizer through the hip. If you want something super simple to practice and you're not ready to try all of these, even just brushing your teeth while picking up one foot and trying to stabilize and balance on that one leg will help stabilize that hip just a little bit more. Use stability tools without shame. This is what I was talking about before. If you need support, you need support. Everybody is different. Everybody is going to experience life in the world differently. This is why I talk to a lot of my moms in our office about belly bands and KT tape. KT tape is what you make of it. Anything in life is what you make of it. I have a lot of chiropractor friends who think KT tape does absolutely nothing, and I have a lot of chiropractor friends who recommend it for many patients and actually apply it themselves for their patients. I'm somewhere in the middle. I truly think KT tape is what you make it. If you think it is if it feels supportive, if it feels good, it's working. It's doing its job. If you feel like nothing's happening and it feels like there's just a piece of tape on your skin, then it's probably not working. Go ahead and take it off. If you already think it's not working, it's not going to work. But if it feels like it is supportive and it is helping you, that mind shift is actually going to shift into better support for the body. KT tape is one. Belly bands are another. What I'm saying is, if you need a belly band early on, you need a belly band early on and utilize it. Because if you don't and you over push your body's going to get more stressed out and start to create more torsion and stress in your spinal cord, less processing for your brain or information for your brain to get from your body. It starts another cascade of issues in your body that we don't want to go down. So if you feel like you need support in your body, get the support. Don't lean on the support like it's a crutch, but use the support when you need the support. If you need support for your belly when you go on a long walk so that you can feel normal when you get home, use it. I think we should be using our tools. If we find a tool that works, use it. Strengthen your relationship with your breath. I think doing decompression breathing is a huge motivator for this. You start to realize how much engagement into your lungs you can get and how much breath you do want to get for you and your baby. So being able to rely on your breath really starts to become a tool when you can't use any other tool. If you're in that early active labor or you're in active labor and you don't have access to tools like pain medications or even a comb to grab onto, or the TENS unit that you requested at the hospital is charging and for whatever reason they don't have another TENS unit and you don't have any other tools. You have your mind and you have your breath. And the more that you practice using your mind and your breath during tough situations or even non-tough situations, the easier it's going to be to access those two tools when you need them. So, for example, we have a couple clients in the office who are going through very significant complications, pregnancy complications, and they're amazing. They're going through these complications with such grace. But what we notice in the office is sometimes these complications, as they start to increase discomfort or symptoms that these moms experience, it starts to really put them in this anxiety stress state with a lot of high breathing, fast breathing patterns. And I was actually out of town. When I was out of town for my vacation most recently, a lot of my moms who needed to come in saw my peer, Dr. David, and Dr. David was able to talk one of our moms down off of a really high anxiety experience with just a couple words. If you control your breath, you can control your body. If you can control your breath, you can control your body. And every time that she has come in since that appointment, when I notice her breath start to engage, I go into my habitual sayings and I'm like, remember, let's try to take a deep breath. Let's connect with your breath again. And she will say out loud her cue, control your breath, control your body. She took that cue from Dr. David, and it has made such a difference in her ability to tap back in with her breath. All it takes is somebody from the outside to tell her, hey, you're breathing really fast. Let's find your breath. And she knows, because that cue made sense to her. Control my breath, controls my body. If I control my breath, it controls my body. So now she has a cue and she has something where she can find control and empowerment over her body in very, very, very tough and uncomfortable situations or times. How cool is that? How cool is that? I thought it's one of the coolest things. And I praises to Dr. David for giving her those couple words that have made such a difference in her pregnancy, and I know will make a huge difference in her labor and birth when those stressful times come up. She's going to have access and such good practice in getting into that control of her breath where she can then control her body. Somehow chiropractic care made it onto this list twice. So apparently I wanted to rant about it one more time, but I'll save you from the rant. Just go get your chiropractic care. Make every movement predictable, slow, and supported. This doesn't mean that you need to tiptoe around your life or, over take your time getting in and out of the car and in and out of your bed every single day. I want you to still enjoy your life, but be more mindful if you're experiencing those instability feelings in your low back, in your pelvis, in your pubic symphysis. We want to be more careful when we're doing some of those bigger movements, like getting in and out of the car, getting in and out of bed, getting in and out of the shower. Even if your tub or the step into your shower is much bigger, or tub, even if you're going to take a bath, we need to be careful how big and how much we're separating our pubic bone, especially if we're already experiencing some instability sensations in that area. Lock your core before transitions. It doesn't mean lock your core, but engage your core and find support before big transitions. And I always try to think of you need 2 to 3 points of support for anything that you're doing. So when you're pregnant, me, Emily, when I get out of the car, if I've gone and run 10 errands, I will carry everything with every square inch of my body. 2 trips is for princesses, and I'm a princess until it's time to get my groceries inside. I'm only making 1 trip from my car to my front door. So I will carry things as crazy as I possibly can, even if it's like hooked onto my pants. There's no support there. There's one mode of support, and that's my foot every time I take a step. That's not enough for pregnancy. I think even having only one hand available going upstairs during pregnancy can be not enough support. So if you have a toddler and you're going up the stairs during pregnancy, that might be not great. That might not be a great idea for you if there's not enough support for your body. So I always think, especially when we get into that 3rd trimester, try to have 3 points of support. That typically is both feet, because you're walking, that's 1, and then both of your hands. It doesn't mean that you can't carry things. It just means that when we are carrying things, ideally your hands are available so that they can support you, and that your legs or your pelvis doesn't try to support you and then eventually put stress on baby if something does happen. Even through all the chiropractic tangents in this podcast that I've gone off of, I'm not really sure that I fully explained why this is so important and why it matters so much to a chiropractor, the relaxin inside of a body. But it really does help me key in where your body is, regardless of the amount of exercise that you do or have done in the past or want to do in the future. The relaxin tells me how much laxity is in your joints and how much support your spine needs day in and day out. This is where I get recommendations for, hey, you need to be sleeping more at night because there's so much laxity in your spine, that there's so much compression in your low back because all of your ligaments are so loose and you're not sleeping enough that those segments are getting smashed at night. This relaxin, because of how clearly I can feel it in the body, it helps drive all of my recommendations for moms, whether it's recommendations at the beginning of their care or recommendations as we go every single week, which I give both. Every time you come into the office, yes, you're on your recommended care plan that we've already started, but I'm giving you weekly recommendations as we find things or as things come up throughout your pregnancy. I feel like I have a really close relationship with relaxin. It doesn't tell me everything, and it's not always the most clear indicator of what's happening in the body, but it does give me a lot of insight to what's happening on the inside of your body and what you might be experiencing throughout movements and motions of your daily life. So relaxin really is deep in a chiropractor's work, especially our prenatal chiropractors. I've said this so many times. Any chiropractor can see a pregnant mom. Should any chiropractor see a pregnant mom? Probably not. Our prenatal chiropractors are so niche in these specific aspects of pregnancy, labor, and birth that it really does help to have their hands identifying where relaxin is shifting in our body, where our body is not feeling support, or where our body is missing support because of relaxin, XYZ. There's a lot more there. So find your prenatal chiropractor. Get in there. And if you can't find one, let me know. I'll help you find one. Okay, now that mama is doing good, I just checked in with mom and dad. They're doing awesome. We're making great progress and making plans to watch progress continue to go. I don't know where to put this cord, but we're going to finish this episode with a little bonus section. So the weird symptoms, some of these I said earlier in the episode that we would come back to, and this is us coming back to them. There are some symptoms that you didn't realize were relaxin-based symptoms, and I want to go through some of those. So relaxin is famous for loosening ligaments. We talked about it this entire episode. But it also causes a whole other constellation of quirky, weird symptoms and things that we experience during pregnancy that everybody deserves to know about. So the first one is peeing more, even in the first trimester. If you notice, in the first trimester, when there's no baby to be seen, there's no bump, you have to pee more. This happens not just because all of a sudden there's a baby on top of your bladder, which yes, that is true and that is happening, but the weight of baby at that point shouldn't be increasing your peeing. What's actually happening is relaxin. Relaxin is dilating blood vessels, which is going to increase your kidney filtration rate by up to 30 to 50%. This makes your body process way more fluid, way more quickly. And this will fill your bladder a lot faster. This is also why you're going to be more thirsty, why you're going to be more easily dehydrated, because your body is constantly filtering all of this fluid inside. So even before your uterus starts to grow, you are peeing more because your kidneys are on a high-speed mode. It's not bladder pressure. It's just your hormonal efficiency turning itself up. Feeling dizzy or lightheaded when standing. Relaxin doesn't just loosen ligaments. It also relaxes smooth muscle, including the muscles in your blood vessels. I talked about this at the very beginning of the episode. Relaxin is going to allow your blood vessels to widen, lower your vascular resistance, so it just allows blood to swoosh through and flow through more easily. It's also going to have a slower return of blood to the heart with position changes. So that can lead to dizziness when you stand, wooziness, feeling floaty or lightheaded, or needing a moment to stabilize yourself before doing the next thing. I notice this a lot with my moms as I set them up from their first adjustment. Typically with future adjustments, it doesn't happen as much, but with that first adjustment where we start to rebalance all of the fluid in the body, it just allows a redistribution, which takes a second for your brain to recalibrate and regain that oxygen as that blood is now swooshing through a lot quicker. We have foot growth and flattening of arches. If your shoes have stopped fitting, hello, Relaxin. This is what's happening. Your relaxin is going to soften the ligament in your foot, the connective tissue that helps support your arch. That's going to relax. And joints in between your foot bones, or if you look down at your foot and you see the long bones, those are going to start to widen and start to soften and relax. This can cause your arch to flatten, your foot to widen, and increase shoe size, and typically more pronation when walking. Pronation is when the arches of your feet roll inwards. So this is not super supportive for our knees or for our hips if our arches are rolling all the way inwards. So you're not imagining it. If your feet feel different, they feel weird in your shoes, it's probably because they are. We also have rib flaring, or the constant one that I hear all the time is my ribs are always popping out. Relaxin affects the ligaments between the ribs and your sternum. So what's happening is relaxin's allowing your rib cage to expand, your diaphragm to descend, and your baby to grow upwards, which can feel like ribs popping out of place, soreness around your rib cage, a sharp rib pinch, or ribs flaring outwards. The rib cage becomes more flexible so that your organs have more space. But with that, we tend to feel a lot of soreness. And because we use our ribs every time we breathe, your ribs never get a chance. They never get a breather. They never get a chance to relax or take a day off because they're constantly needed to keep you moving. So this soreness tends to last a lot longer, but the tolerance and the stability and strength that you build over it, the empowerment that you'll build over it, will be so much more significantly greater because you can't stop it. Your body does have to overcome it at some point and adapt to that stretch, laxity, flare, whatever it is that happened to your ribs. We have pregnancy clumsiness, a real thing. Balance changes drastically when your ligaments loosen, and relaxin contributes to less ankle stability, shifting of the pelvis, altered gait, changing the center of your gravity, slower joint response times. Some moms trip more easily, some feel more off balance, some bump into things. It's not you, it's biomechanics, and it's hormones. The clicking, popping, and loose joints everywhere, as much as that's kind of normal for regular humans. It is more regular for pregnant women. Relaxin increases joint play, or the amount of motion you can have in a singular joint in your ankles, knees, hips, wrists, ribs, spine, SI joints, and pubic symphysis. That's why moms always or often feel clicking when they're walking or popping when they squat. It's usually a pop sound or a feel that you feel in your SI joints or in your sacrum when you come up from the squat. And then we have those round ligament zingers. Those tend to be from relaxin. As relaxin comes through, baby can drop down a little bit lower. Ligaments don't like to be overstretched, so they're going to check the joint or doorstop the joint and try to contract and save. And that zinger is actually going to send a referral of zinging pain up through your body, typically. We have the flat booty syndrome. Yes, that's real. Pregnant women often say that their butt disappears, and that is a lot of times part from relaxin. Relaxin loosens the ligaments around the pelvis, and your pelvic alignment shifts. So your glutes can change their line of pull, and they don't always fire the same way, but the butt can start to look flatter and shorter. It can come back postpartum with alignment and proper strength work. And then stretch marks and skin texture changes. Relaxin affects all connective tissue, including skin. So with our skin, we have softened collagen, increase in our skin elasticity, reduce in tensile strength, and it allows for rapid stretching. That's why we see stretch marks with pregnancy. Sometimes when that relaxin doesn't quite relax or soften the collagen as quickly, that's kind of where we see the discoloration in stretch marks. But for the most part, most people get stretch marks. We just don't always see it depending on coloration of our bodies. This combo makes the skin more adaptable and also more prone to stretch marks, itching, thinning, and softer texture of skin just in general. We also have bleeding gums when you brush your teeth during pregnancy and postpartum. Part from breastfeeding and other things. This part, though, can be from relaxin. There can just be a little bit of laxity in your teeth when you brush them, and with some pressure around your teeth and tough bristles around those gums, it can just allow for a little bit of bleeding. Not super abnormal, not anything wrong with you. It just means we've got relaxed ligaments even around our teeth. Softer abdominal wall or an early pooch, nothing wrong with you. We need space for a baby to grow. But sometimes your body is already prepped with that extra skin or with that extra elasticity in the soft tissues. And so we see that baby pooch come out a lot quicker, even if it's really soft. That's just your body's relaxin, allowing the skin and the connective tissue to relax and soften so that it can eventually stretch once baby does start to grow into that space. That is normal. I want that to be so clear. A lot of times we see moms who are like, is it the bloat or is it the baby? The bloat isn't the baby, but the bloat is for the baby. That bloat is your body prepping space for baby. So yeah, another little catch-22 there. We see baby bump, but is it a baby bump? It really just feels like bloat and it's really soft. It doesn't feel like a baby. That is your body softening tissues so that baby can grow into that space. That isn't quite your baby yet. Baby's back there, but they're usually a lot smaller than that pooch space. And the last one I have is our emotional sensitivity, or just feeling more tender in general. Relaxin works in the brain too. Relaxin has this calming, soothing, and anti-anxiety effect in the brain. It allows for bonding, maternal behavior, and emotional openness for moms. And so it's often overlooked, but it's really important that we recognize relaxin is helping our pregnant women feel more sensitive, feel more tender, feel more soft-hearted, feel more open, and feel more connected. So relaxin is working through our entire body. It is helping us through so many different challenges, and not just challenges, changes and exciting things that happen and transformations that happen throughout pregnancy, labor, birth, and postpartum. So let's welcome relaxin into the room. Give her a seat at the table, welcome her, and start to engage her into all of the other stabilities that you have in your life. As she might bring some instability into your life, we want to show her different areas that we can work with her so that you guys can work together as a team to help your body be as prepared as possible for a baby to come. Remember, without relaxin at the table, birth is not possible. We need her there. So how can we work with her and really encourage her amazing effects on our body to be supportive in our body and help us feel stable, not just so unstable and not supported and discombobulated. We want to make sure that we use relaxin to our advantage and we don't just push it off to the side of the table and wait until we feel too loose to call the chiropractor and say it feels like my hip popped out, right? We want to be a little bit more proactive than reactive. So I hope you enjoyed this talk with Relaxin. I am going to finish this up, edit what I can prior to going to this labor and birth. I think I have some hours, so hopefully this comes out on time tomorrow. If not, you'll see it later this week. If you have any questions about Relaxin or specific questions that I didn't address here in this episode, please DM them to me. I would love to read them and then figure out the answer if I don't already know it. If not, share it with you. So I hope you guys have a fabulous week. If you've been enjoying the Popped podcast, please like, subscribe, hit the review button, whatever feels good to you. I hope you have a great week. And I'm Dr. Emily, and you've been listening to the Popped podcast.